So thank you everyone for joining us today. So I'm Lorna Stabler. I am a researcher here at Cascade at Cardiff University. And I'm delighted to chair this session today. So thank you again for coming along to this webinar focused on, as part of the Exchange conference series, which is focused on informal carers. So we've had a few events already. You can catch up on recordings and podcasts on our website, and I'm sure we'll have links shared in the chat to the other events as part of this conference series. And we still have a few more throughout the month. So thank you for joining us today. I am really pleased to be able to welcome Dr. Maria Cheshire-Allen, who is a Senior Research Fellow at the Swansea Centre for Health Economics at Swansea University. Her research focuses on family carers, care inequalities and social care markets. We're really, really happy to have you here today, Maria, as part of this conference series. Maria's going to reflect kind of on the importance and the kind of lack of support and protections for unpaid carers, and she's going to share some new work. So this gives people the opportunity to kind of shape the ongoing work in this area and really get involved. So Maria will present now, but we will have opportunities for reflection and chat. So if you do have some kind of initial thoughts, please feel free to use the chat box. But if you have questions that you want us to come back to at the end, please use the Q&A function on Teams. And hopefully, I think Maria will talk for about 35 to 40 minutes. So we'll have plenty of time for people to kind of feed in, ask questions, and you'll also have Maria's details if you want to catch up with her kind of after this session. So thank you so much for joining us. I think Sean has just popped in the chat as well that there may be some sensitive issues that come up during the presentation. So please kind of keep that in mind. And I know Maria will sensitively take you through these topics. So I'm going to pass over to you, Maria, and I will keep an eye on the chat for you if you can't see it at any point.
Thank you. Thanks very much, Lorna, and thank you to Exchange Wales for having me. I'm really grateful for this space to discuss what I hope will be worthwhile and interesting to you all. So yes, I'm Maria Cheshire-Allen. I work at Swansea University, and I'm going to talk to you today about some of my research on unpaid care, carer well-being, and what I'm calling the civic debt. So I'm going to briefly just here guide you through the presentation today, like Lorna said, about 30 minutes, 35. But like I said, I want to give it plenty of time for us to actually be able to interact and discuss. So I'm going to tell you a little bit about my research and background, and my research really around valuing unpaid care. Talk to you about the straightforward but perhaps slightly uncomfortable questions about the civic debt, what it is and why it matters, and what do we owe the people whose care in labour our systems, our welfare systems depend upon. So I'll cover some of the theoretical arguments and some of the evidence broadly in the field, and then the research that I've been carrying out, some of the findings from two projects entitled DISC and Invaluable. And then also give you some initial analysis, some of the things that we're developing to draw out this democratic framework. And really sum up and ask for more involvement really and collaboration in taking forward a new programme of work that I'm entitling Cura at the moment, which will go forward into a major European Research Council grant next year. So before I go any further, I just thought I would introduce, I've got a bit of time, which is nice, to let you say, to tell you briefly about why this matters and why I care about unpaid care. So I've had lived experience as a carer, and that has been the foundation of my work for almost sort of 20 years now in the field. So I worked as a paid carer many years ago, working in residential care homes in what were then called EMI units, elderly mentally infirm. And then I've also more recently been an unpaid carer for my dad and my grandmother who had vascular dementia. So before I moved into academia, I also had quite an interesting career working for NGOs in the third sector in Wales, mainly in Age Cymru, where I was the policy and campaigns manager there for age equality. So now I'm a gerontologist, so I study aging and dementia, and I've been at Swansea University for many years, and more recently my work has more focused on unpaid care, and that has been developed through work as a researcher for the Centre for Ageing and Dementia Research. And then I've been awarded 2 research fellowships from Health and Care Research Wales. One is looking at the role of social enterprise organisations, and more recently, the fellowship that I'm going to talk about today is addressing the civic contribution in unpaid care across Europe. And I'm also keeping busy as a trustee as well for a local carers charity. So research falls sort of broadly into 3 main pillars. It can be quite confusing to understand, especially with as a researcher in lots of broad ideas and lots of different programs of work. So this is broadly where my work fits. There is looking at the experiences of care and the outcomes of care on carers. So my PhD research in 2018 looked at well-being of unpaid carers using a capabilities approach. If anyone's familiar in the audience with Amartya Sen and his work, and a care ethics approach to well-being. And then recently, I've been working with colleagues at Cardiff University and elsewhere through an NIHR-funded project that's looking at the risks and harm experienced within home-based care, and also looking at sort of more of the sharper edge of things where carers are victims of abuse, and that's been developed at the moment in a paper with my colleague here at Swansea University, Professor Sarah Weidel. And then this green column here is really the work that I do around sustaining and supporting carers. So the research here is focused on drawing on my experience within the third sector on the role and the contribution of civil society organisations to unpaid carer wellbeing outcomes, and particularly looking at the role and the outcomes of co-production and participation. And within that, I'm looking at some of the minority carer groups, particularly Black and minority ethnic carers, dementia carers locally here in South Wales. And then finally, this orange column is my sort of work, which is focused more around valuing unpaid care and making care visible. And I've had 2 funded projects here, which are looking at the economic evaluation of unpaid care, which is invaluable, and the value of unpaid care systems, the value of unpaid care to democratic systems, which is the CURA project. And it's this orange column that I'm really drawing most of the work from today. So before I go any further, it would be really nice if I could just have a little bit of a interaction with you in the audience, and just to have an idea of where you're coming from, or some current ideas. So if you'd like to, in the chat box, just one word or phrase or one thing that would make the biggest difference to unpaid carers right now for us in Wales. If 30 seconds, if that, just pop a response in the chat box, and I will try and get the chat up so I can see. Okay, great. Fabulous. Recognition, yeah. Better implementation of Social Services and Wellbeing Act. They need systems and professionals that trust and value them. Really interesting. Recognition of support. Great. Anyone else? Information and advice. Yeah. Signposting. Absolutely, yeah. Support. So I'll just see if there's any more. Thank you for that to those who responded. That's great. So you could see some of these responses are about resourcing, services, advice, information, support. And there's just a little bit there as well about less tangible things such as recognition, and perhaps being heard, and having that sort of value from and some of the values of trust and respect as well. So the research that I'm sharing with you today is really going more into some of those things, and what some of the less tangible aspects of care, some of the second character, because unless we can properly resource something, we have to be able to value it properly, and it's very difficult to value some of these less tangible things. So I'll be coming back to maybe what you said earlier when I go into some of my findings, because that was really helpful. Thank you. So moving into some of the civic engagement work in the field at the moment, there's some research and there's lots of policy that points to civic engagement in later life, where my research in this area is fitting. So civic engagement broadly underpins all our sort of healthy aging frameworks, age-friendly communities, and approaches to social inclusion in later life. So civic engagement shapes how we think about what older adults can contribute. And there's been some really important work carried out recently by Rodrigo Serrat and his team. It's a cross-European study. And he has showed that existing gerontological definitions of civic engagement have left unpaid care relatively untouched, and definitions of civic engagement have focused mainly on volunteering and kind of that formal participation, but to the detriment of unpaid care. But the empirical data tells us quite a different story, and it actually confirms that informal caregiving is the most widespread form of civic activity amongst older adults in Europe. Yet it's absent from some of the most dominant policy frameworks that determine sort of our active ageing policies and age-friendly policies. So the World Health Organization Active Ageing Framework does emphasize volunteering and that kind of formal participation. But what the empirical work is telling us is that people are actually, their form of civic engagement, you could understand, is actually unpaid caring. And one of the reasons I think I want to just suggest that this is happening is because it's what I've termed sort of an ageist logic. So there's older people who are receiving care are often framed, despite some really good intentions and some challenges, but they can be framed as dependent and burdensome. And the carers who are caring for those older people are framed then, therefore, as the productive workers to relieve that burden. And we often see this in terms of the second NHS workforce, the hidden backbone, unsung heroes type thing. Every one of these framing counts as caring as labour, but we don't see it showing up as civic contribution. And from our studies here in Wales, this is from the Invaluable project, one of our participants in the focus group said this quite succinctly: we don't want to be unsung heroes, we actually just want to be recognised. So it's this kind of area that I'm working in. So where I'm going to go to next is bringing the research into Wales, and we could argue, I think quite convincingly, that Wales has some genuinely progressive foundations for carers in Wales. The Social Services and Wellbeing Act established carers' rights in law. We have the Future Generations Act, which is long-term and innovative. And we have the Social Partnership and Public Procurement Act, which enshrines the fair work principles for paid workers. But I just want to stop and pause on this piece of legislation here, because there's quite a paradox, I think. Unpaid carers are performing equivalent labour, but you could argue that they are actually excluded from this, and that this is a structural exclusion. And it's a concrete example, I think, of what is meant by civic debt. But we do have AMSA, the AMSA programme, which has been an enormous, and it really confirms what I hear all the time, is that one of the most fundamental unmet needs is time. And we have the draft national strategy, which includes a commitment to be a carer-aware nation. And we also have the Carer Support Fund, which provides financial support for carers on low incomes. And these are real achievements, and they really do matter to carers. But unfortunately, there is the but. The Senate's own committee, Health and Social Care Committee report, found in April this year, and we're all probably familiar with these figures, that only 4,924 carers have a support plan. And the report concluded that little had changed since 2019. So my work is focused on the question of how we can see and understand time spent caring as time that counts. And I think this is a civic value question. And to understand why it remains unanswered, despite the well-intentioned policies, we need to look at some of the recent research and empirical reasons why, which is where I'm going to go to now. So what if caring is a form of civic participation? The work by Rodrigo Serrat and others has sort of confirmed that research has tended to treat caring as a constraint on civic participation, something that prevents older adults from engaging. And Serrat and others argue that they're treating older people as contributors to sustaining welfare states rather than political activists who might challenge and change them. And we just have only 2 weeks ago, I just saw this consultation come as I was preparing for this. This is a recent consultation from the UK government, part of their Make Work Pay. And it was published a couple of weeks ago, and it does apply to Wales in terms of its employment rights. And I think it illustrates that the case for paid carers leave, which would be enormously beneficial for us, but it's framed entirely in those economic terms. 3 million carers are leaving the workforce, costing 37 billion to the economy. So that's a labour market argument. It's not a civic contribution sort of argument. So it's made entirely in those terms. So to understand why, I think we can really draw from some of the really helpful work provided by some of the care theorists, and in particular Hannah Kaiser Hoppeneyer's concept of the depoliticization of care. And I think that gives us a really nice theoretical starting point. So she tracked in Finland the legislative process of the Care Act for older people. And she found that what began in that legislative process were questions about values and what we owe to older people and those who care for them. But it was gradually converted into a technical question, and it was reframed as an administrative problem rather than, as what she concluded, a political one. And when that happens, we see that carers are sort of removed from that political sphere. And that they are not, they're not citizens making claims. They can be understood, as she argued, as service users to be managed. So whether you agree with that, I think it gives us a nice foothold to begin some of the discussion. And my work is also running alongside this description of depoliticization is an approach to understanding care called a feminist care ethics, and I'm sure many of you are familiar with this approach. So care ethics understands the world as comprised of relationships of interdependence, not individual or autonomous, and that care is rather than a private burden, is a fundamental social and political practice. And Joan Tronto has been one of the main sort of 4 theorists in this area. But I'm really drawn to the feminist care ethics approach because it understands care as a site of contested logic, a site of contesting rights and values. So it acknowledges the complexity and messiness of care, which I've seen myself in my own personal and in my work. And care ethics gives us a normative framework in order to be able to understand and assess what a caring democracy must look like. And within that, Toronto gives us her 5th phase of caring, which she describes as caring with. And she says that ultimately carers must have a genuine voice in the systems that shape their lives. And that's absolutely integral to her definition of an caring democracy. So sorry, this is a very long-winded definition here, which is work in progress. So I've been building these ideas. I've developed this idea around the civic debt, which has been termed as democratic vulnerability. And this is a work in progress. It's under review at the moment in the European Journal of Social Work with my colleague Sarah Weidel. And it's built on some of these ideas of depoliticisation of care and a feminist care ethics approach. And we've actually done a policy analysis of policy in Wales. So it's building on this that I'm going to take us into the actual research, but I'll just stop and pause at the moment before I go into methodology and see if there's anyone wants to put any comments in quickly before, if you're anything like me, you'll forget at the end. So please, before I bombard you further with the methodology, if there's anything anyone wants to say or put in the comments, then please do. I'm aware it was a bit heavy theoretically. So my work has been really shaped today. The work that I'm going to talk about has been shaped by 2 concurrent studies, the DISC study and the Invaluable study. And they've been mixed methods, and they're generating the initial framework that you can see on the left. The empirical findings have been based on mixed methods, interviews and surveys and focus groups. And the framework that is pointing down at the bottom there is the developing framework that will be tested, and more properties will be detailed in that framework with hopefully the proposal at a European scale. And these are the questions ultimately that this work is trying to address. What would social care look like if the value of unpaid care was understood as civic value and measured as rigorously as that? And that's the Cura project. So I'm going to go just quickly to how the study design. So this first one, the Invaluable study, was focused on instruments. The evidence comes from a funded study from the Wellcome Trust and the British Academy. It's the Wales, and it's comparative, so it's across Wales and Basque country. And we asked unpaid carers what they thought of the instruments used to measure their quality of life and well-being. So we asked them about the EQ5D, IceCap and the ASCOT. We had in total 23 carers in the Basque country and 15 in Wales. And we used this thematic analysis and an analytical framework I outlined previously. And on the right here, this is my Healthcare Research Wales Fellowship project that is looking at how civil society organisations support unpaid carers, and is asking what is drawing upon the focus groups and semi-structured interviews, and shares that same analytical lens. So one focuses on the carers directly and the other focuses on the organisations that support them. So I'm going to go into the findings now, and they, across both studies, these 3 working themes have kind of can be theorised. And there's something around both of the studies where we can see care can be simultaneously life-affirming, but also life-limiting, and that the existing measures that we use can't hold that. Care and knowledge and civil society knowledge are generated and then systematically lost. And then the third one is around participation without interaction. So these are overlapping, they're not separate findings, they intersect. And they together they generate what I'm arguing is this democratic vulnerability. So I'm going to take each one in the next few slides and give you a bit more detail based on the study findings. So the first theme emerges consistently across the both studies is that caring is both life-affirming and life-limiting, but that duality is absent from our current measurement frameworks. And this participant from the Basque Country describes caring for her mother with dementia, and the moment her mother calls her daughter, she refers to it as winning the lottery. So it's these small connected moments, unexpected a lot of the time, that people describe to me a lot in my research with carers, which disproportionately sustain them, but none of the mechanisms were able to capture that. And that's not to say that all care is positive. We know that care can come at a significant cost: early labour market exit, pension gaps, health outcomes. And all of these things have been measured empirically using objective measures. But things can happen simultaneously, where it can be, as people describe, a really life-affirming thing, but it can also come with it lots of structural penalties. And I do want to be clear here that, like I say, not all caring is positive. Research that I've been involved in, it does document, that care can be harmful and even care can be abusive. But that is part of the complexity that this theme is naming. And what the research also found was that consistently across both Wales and the Basque Country is that even though the carers described hardship, they said that they would rather do it than not. But secondly, there was a really interesting finding around guilt, and one of the participants stating here, you never get rid of that feeling. So carers do describe this as the emotional experience that, and it was absent from the current measures. The EQ5D, ASCOT and ICECAP didn't actually capture that guilt-driven restriction. And I want to suggest that guilt isn't really a psychological problem requiring that individual intervention. Perhaps it's more of a structural sign. So guilt and the life affirmation and the structural penalties, all of this coexists, but the measures can't capture that. And what I want to suggest is this what is produced when we're simultaneously being depended upon, but not recognised or valued? And then turning to the second finding, which is about knowledge and who generates it and what happens to it. So in both sites, in both studies, rich experiential knowledge and relational knowledge was being produced, and that carers talked about and carer organisations talked about. But as one civil society, the CEO from a civil society organisation told me, we're telling you what's working and changing, but nothing is responded to and nothing changes. And it's like that knowledge and expertise goes into a black hole. And again, perhaps this is more of a structural problem where knowledge is generated, it's extracted to fit reporting requirements, but it's not actually used in some of the frameworks designed to govern care. And carers we speak to as well across both funded studies also told us the same thing, but more at that obviously individual level. So every time you ring, you speak to someone differently and you have to start over again. And that's exhausting, I know, in itself. So, and that expertise, which is built up over years of caring, can be lost between all of those different service contacts. So what this research adds to this is that the knowledge is not necessarily acted upon, the expertise is lost. And what I'm suggesting here is this is a form of epistemic injustice where the knowledge doesn't fit the system, so perhaps it doesn't get counted. And then the final theme is about time and who has it. And one of the most consistent findings from the DISC project is that the relational work that actually sustains carers and communities requires time, but again there's some structural systems that are pitted against. So a lot we have the social services and wellbeing act, which places co-production at its heart, but again, civil society organisations and other statutory organisations sort of have told me the frustrations in trying to do co-production work, and that actually you need time, you need to slow things down, but everything about the systems require us to be speeding up. So co-production is named in our commissioning frameworks, but the time and the relational infrastructure that genuine co-production requires is not supported. And as for carers, there's something where caring is total time. It can completely subsume your life. And carers are consulted, we know, through forums and surveys. But what actually really enables participation is that time. And time poverty is really what carers tell us that they have. Very much so. They can be consulted, but the time poverty can result in that political exclusion that we're referring to. So taking all of this in, the three themes that I've described map onto some of those dimensions of democratic vulnerability, and there's some dimensions which the framework is emerging, is very much a work in progress. And it's certainly not prescriptive, and it's just offering a sort of diagnostic lens or tool. And there's some questions under each dimension. Epistemically, where is care and knowledge being erased? How can we treat the care and civil society evidence as policy evidence rather than perhaps compliance? Institutionally, where is co-production actually genuine rather than perhaps performative? And politically, what would recognition as civic contributors actually look like, and how can we measure that? So that's what our evidence is finding so far, and the framework is very much grounded in this work currently under peer review in the European Journal for Social Work Research. So the next steps are to take some of this emerging framework across different social care contexts across Europe, and this is the work that I'm trying to develop into a Cura bid, the ERC. So just to sum up before I come to that, the evidence from both studies points sort of towards a consistent direction that carers generate and sustain relationships. They maintain the conditions under which vulnerable people remain members and can participate in society. But across Wales and the Basque Country, caring is described as intrinsic to their identity and their civic life. But what the evidence also shows is that contribution is unmeasured, and the quality of life instruments do not actually are not able to actually measure those things effectively. So every hour a carer spends caring is an hour of the democratic infrastructure being maintained, but this infrastructure, this knowledge about what it means to flourish and help a human in caring relationships is not measured effectively. And we are terming this a term democratic vulnerability, which is perhaps a work in progress, one could say, and will be developed further in our work at European scale. So just to come now to the final slide, and before I take any more questions, these findings are preliminary and they will be tested in this new bid called Cura, Care in Democracy, Revaluing Unpaid Care Across Europe. And this will go to the European Research Council, hopefully as a starting grant, and the framework will be extended, changed, complicated further, I'm sure, but taken at scale and tested across these different social care contexts. So far it's only been between the Basque Country and Wales, and really I would really love it if people would be willing to get involved. I'm looking for expert stakeholders, practitioners who can contribute their knowledge of where participation is working in their own context, because I'm sure it is, and where case studies of democratic inclusion of carers is genuinely being attempted. So if any of this is connecting with you, and you're thinking that you'd like to get involved, I'd really welcome a conversation. And my contact details are on this slide here. So thank you.
That is perfect, Maria. And I think you said you would speak for 35 minutes, and we started, I think, at 2 minutes past. It's exactly 35 minutes. So I am incredibly impressed.
Wow.
So just to say, your email address has also been shared in the chat, so people can kind of click on that.
I'll stop sharing.
Okay. Perfect. Okay, thank you so much for that, Maria. I've got like some things I could definitely ask about and would love to reflect on, but I just want to encourage people kind of on the call to put any questions in the Q&A box up at the top, and I will read them out to Maria. But I guess as a starting question, Maria, I wonder about asking you the same question you asked all of us at the start. So what do you think the one thing is that would make the biggest difference to unpaid carers in Wales?
Yeah, I think absolutely you can't deny people need resources. And I think, like I say, the Welsh Government has been really progressive in that realm. But I think especially with the work that I did in COVID, where we had the Clap for Carers and the Clap for Heroes, I was doing a lot of my fieldwork during that time. And there was a lot of frustration expressed to me about that from unpaid carers. They felt really removed from that whole movement, really. And I think that's what this work is trying to get at, is understanding that care is actually so fundamental that it can't be reduced to those economic metrics. And it's tricky, it's really hard to work out, because we work and we live in this society that does privilege economic metrics over well-being. But there are really progressive things happening. I think the work in Welsh Government on social value has been really important. And some work as well around the disability survey. I think we have got some real sort of space for traction in this area, and it's just a case of, I think, bringing it together in sort of a succinct bundle and being more, I hate to say it, more political about it. And really, I know the care organisations that I work with and partner with have that obviously very strong campaigning presence and voice. But I think as researchers, we're really missing a bit of an important aspect of the work in really starting to politicise and bring carers back into that political sphere as described in the theory section of the slide.
Yeah, I think it's really interesting. It's a challenge in my own research. So I do research around kinship care, so a bit different to what you're talking about, but actually a lot of it is also unpaid care for children, so informal kinship care. I was just wondering, so you mentioned really like at the start about the framing of kind of the cared for as being dependent and burdensome, and I think that happens in elder care, but it also happens in kinship care for children. And those people who are cared for can take that narrative, it can be quite a damaging internal narrative to have. So I wonder where you think like the work that you're doing and the recognition of unpaid care as kind of work fits with also those narratives around cared for people and kind of their participation and their kind of democratic engagement as well.
Yeah, that's a really good question. Some work that has been carried out at a sort of World Health Organization level is looking at how if we help to support the long-term care economy, then actually it can be good for GDP generally. So I think that's sort of a step in the right direction in understanding and addressing and challenging some of those ideas around care can only be burdensome, it can only be a drain, where actually if we see care as something that can actually attract income, it can actually sustain communities and economies, then I think that can be a really helpful place to start, but also be really careful to resist that just commodification of care, which is also a really tricky balance. And again, I think as researchers, we need to step up and be able to do that a little bit more clearly. And I'm by no means doing that. I need to work with others and hear from, and the other age spectrum is really helpful. But yeah, traditionally, care for older people has been typified by degeneration, burden, and therefore that carer, particularly carers of people living with dementia, where there is some significant stigma, then that they sort of internalize, not only internalize, but they also experience that at structural levels as well. But like, yeah, I really think we have a lot to do in sort of trying to bring some of these debates together, whilst also recognizing it's a really tricky and complex space.
Oh, so we've got a question from Catherine Cullen here. So Catherine's asking, is there much data collected on who is providing unpaid care in Wales? Are there organisations who are collecting this data?
Yeah, we've got, well, the organisations definitely are collecting data in many different ways. And that's part of the issue, I think, is that organisations have to be able to sustain their funding. So there are often multiple different funding mechanisms that play, and having to report to different organisations who are funding the programme. So there's also, obviously, the census has been huge, and we've been able to show that there's 310,000 carers living in Wales, but actually that number is probably very inaccurate and underestimates. So yeah, there's lots of different, I think there's some people in the room who probably be able to answer this better than me about what data, if it's particularly social enterprise or civil society organisation data, what they hold. But yeah, from my experience, there's huge wealth of knowledge, obviously expertise, but from the research that I've done, there's frustration in having to fit boxes and fit sort of measurement frameworks which aren't what some of the work really truly reflects, which led me into that sort of feminist care ethics approach. And the work that I was doing with local charities during COVID, they were actually expressing and doing the work of feminist care ethics, but it wasn't captured in a lot of the frameworks when they had to measure their outcomes and outputs. So there's definitely sort of another space there in terms of commissioning frameworks more broadly, to enable these organisations to be able to actually truly reflect the value of their work and the difference it makes to unpaid carers.
Yeah. No, thank you for that. I think kind of related to that question, Dan's asked kind of how widespread is unpaid care? So it's a big question, but actually, do you think there are a lot of people who don't recognise that they're providing care? And do you think does this limit people's awareness of accessing support if they don't recognise that actually caring is what they're doing?
Yeah, absolutely. Recognition is huge. I think the first part of your question, 1 in 11, I think, in Wales is an unpaid carer. And some research carried out at the University of Sheffield a couple of years ago, based on huge data sets, showed that 1 in 3 of us will care at some point in our lives. So it's something that's universally experienced pretty much. So it's hugely, and like I say, recognition is one of the reasons why we're not able to properly sort of reflect the true number of carers. And related to that, what we were talking about with the sort of burden discourse, the stigma attached to some of these conditions that carers are caring for, the person is, the person they're caring for has, means that many carers aren't necessarily recognising themselves as a carer who does and should be claiming rights and support. So yeah, there's lots of issues around recognition, which again, organisations working on the ground with carers themselves are really sort of agile and able to support people to understand themselves as carers, and then sort of get some of the support that comes with that.
Yeah, I guess so. Just to jump in with my own question again. So you mentioned kind of in your presentation how Wales actually has some really progressive, kind of forward-thinking legislation around carers, and there is quite a lot of potential support available, but actually the uptake is not really there. And I think you said like little has changed since 2019, which considering there has been an increase in recognition and, you know, I've seen a lot more around unpaid care. What do you think what do you think the real barriers are to people it's good for people to say there needs to be more resources, but actually when the resources are there, how do you increase that uptake, both in terms of individuals reaching out for support, but also that kind of proactive identification of carers?
I think again it's a multi-team approach, isn't it? I think a lot of people I speak to find approaching social services and you know, very, very difficult, and that the civil society organisations are the place where most people will start with, because it can be really difficult to navigate some of the statutory organisations and be able to feel that you're being heard. And I think that's one of the big issues. When I speak to civil society organisations, they say we don't have a time limit. Many of them will still support you even if the person that you've cared for is no longer with you. So there's a big issue, I think, around the systems and the structures that aren't possibly very carer friendly. And you know, it is unfortunately down to resourcing and sometimes training. But again, I think there has been some really promising things led by Social Care Wales and others to support you know, this area. But just based on what I know from talking to carers themselves, it's just such a hugely complex system. You need hand holding, and you need, you know, a certain level of health literacy and everything to be able to actually navigate that. And that's something that carers often don't have if they've been up in the night every night for months caring for someone. So I think that exhaustion, trying to sort of fight systems or navigate systems, is something I hear really consistently, unfortunately.
Definitely. I think what really stood out to me from your presentation, you know, and also, you know, comes up a lot in my research, is just people are constantly sharing their knowledge. You know, they're constantly telling services, systems, people kind of what they've learned, what they need, what they're doing, what the challenges are, but that doesn't go anywhere. You know, and people are having to share their story all the time, or repeat information, or see that nothing changes. You know, they've said X, Y, and Z. So I wonder what mechanisms you think there could be to better use some of that knowledge to inform policy making. So considering that knowledge comes in through so many different routes in organizations' interactions with carers, are there any examples that you know of where that is kind of used really well to inform and shape policy and services?
There's plenty, just not at scale and at national level, unfortunately. So the most significant change approach from DEEP, led by Nick Andrews and Jill Toms in Bangor and Swansea. I mean, that's a great example based on evidence, based on research, that's working in some areas in Wales really well, that draws upon people's lived experience, their own words, their narrative, to actually influence policy and change. And there's loads of interesting and really inspiring examples throughout Wales that we can build upon. But yeah, it's just having that kind of mismatch between what's happening in some pockets and actually what's happening at scale, which is really what the research that I'd like to be doing in Wales, and then comparing it across different European contexts as well. So because I think that could be an important contribution.
Yeah, and hopefully there's people in this room as well, or on this call, who are using some of those approaches, who have some really interesting case studies.
Sure, there are.
Yeah. Does anyone have any kind of final questions for Maria, or any final reflections? sorry, I could ask you so much. I could just keep asking you questions, but
we're in between lunch for some people.
Yeah, definitely. So I don't think there's any more questions at this point. But just to say, so everyone has your email address. This has also been recorded. So if anyone wants to get in touch with you, they're welcome to do that by email, I assume,
Absolutely.
Maria?
Yes, please. Absolutely. I'd love that.
Yeah, and you're kind of actively looking for people to kind of get involved in this work. So if anyone kind of wants to take this further, please do get in touch with Maria. And yeah, so it's just for me to say thank you so much, Maria, for such an interesting talk. And I think, as you say, one in 3 people will kind of be a caregiver, a carer at some point in their lives. So this kind of really touches on so many people, and that's not including the amount of people who will be cared for as well. And this, impacts them just as much as it impacts the carers as well. So yeah, thank you everyone for coming along and for your engagement. Sian and Dan have been sharing many links and things in the chat as well, so do follow up, engage with the rest of the conference series. And Maria, you as well, we'd love to see you at some of the events over the rest of the series. So thank you very much.
Thanks very much for having me. Thank you.